Hello, everyone, and thank you for tuning in. This is Stephen Dell Jones with Tampa Bay AccuHealth and Spine, and today I want to go over a little bit some information about interstitial cystitis, also known as painful bladder syndrome. This condition is characterized by chronic inflammation of the bladder wall, which leads to continuous pain in the bladder. Patients will experience pain in the lower pelvis. They experience pain when they have to urinate, pain as the bladder fills, and they usually have very frequent urination many times a day and often many times at night, which keeps them awake at night. So it is a chronic problem that is very problematic, very painful, and it's heartbreaking to see patients who have come to me who have had pain for so many years, for so long, whether they're on medications or not. Sometimes they have pain for so long that they're at their wits' end. It's a very painful situation. The bladder wall itself develops a lot of inflammation, and the more the bladder fills, the more water a patient drinks, the more pressure is exerted on the walls of the bladder, and there's more and more pain. So that's very unfortunate. Sometimes patients will even tell me that they are scared to drink water because the pain will continue to increase. So that's very unfortunate. The great news, though, is that there's a lot that can be done with both acupuncture and point injection therapy. What acupuncture does is decreases internal inflammation along certain meridians, which we can know which ones will affect the bladder channel and the bladder organ. So by manipulating certain small, fine, sterile needles, we can reduce the internal inflammation that's coming from the bladder, and we can control pain and actually reduce the symptoms for some time. For very recalcitrant, tough cases, sometimes we need to go a step further, and it's very fortunate that we can use something called point injection therapy, where special homeopathic injections can be used that reduce internal inflammation even more, and they're actually injected into the acupoints along the meridians that affect and influence the bladder organ. So certainly the injections do not need to be done into the bladder itself. They're done in acupoints along the legs, and these small injections have a variety of botanical ingredients that reduce internal inflammation. They are produced in ultra low dose frequencies, and they do benefit the internal inflammation. And it's really, really fantastic that they're able to reduce the internal inflammation, reduce pain, precisely where we want to send it to. In the case of painful bladder syndrome, we reduce pain in the bladder tissue. So that works very well. I have patients who've had problems for many years, and they're able to get a periodic homeopathic injection and greatly control their symptoms for a very long period of time, sometimes going weeks or months between a treatment. So that's tremendous for this type of situation when someone has had so much pain for so many years. So certainly acupuncture and point injection therapy are very beneficial for painful bladder syndrome. For more information on point injection therapy, what the homeopathics are, what these German-made compounds are actually composed of, how they work, look at tampabayacuhealthandspine.com and look at point injection therapy. It's a very effective treatment. It's been in use in Europe for many years. A little bit less common in America, but it certainly has a very, very valuable place for most chronic painful situations, including interstitial cystitis. So for more information, please look at Tampa Bay AccuHealth and Spine. We hope that you find this helpful. We hope that you find some great resources for your condition. Let us know if we can be of help to you. Thank you very much.